Hello everyone, myself Dr.UMARANI. In this video, I will be talking about very short 2 mark questions in the previous year question paper for BHMS first year students. Question paper is taken from the KNRUHS University of Health Sciences, Warangal in the year September 2022. Before moving to the question paper, if you are new to the channel, subscribe the channel. I will be coming with more videos, and also I will give you link of other papers, solved answers, very short answers of paper 1 and paper 2 on the description box. Let's move on the question paper. So this is the first BHMS September 2021 anatomy question paper. So here the essay questions are given. One is that elbow joint under the following headings, that is the bone staking part, ligaments, blood supply, movements, applied aspect. And second question given from that ventricles of the brain with their communications, and describe in detail about the fourth ventricle. And the short questions, corpus callosum, upper end of the humerus, deltoid, palatine tonsil, superficial palmar arch, temporomandibular joint, ligaments, retina, suboccipital triangle, tympanic membrane, boundaries and contents of the axilla. And these are that brief on questions. So here I'm going to explain about in detail about each question, very short questions. So the first question, it is the ray neck. Ray neck, also known as that torticollis. Torticollis comes from the Latin word tortus, which means twisted, and column, which means neck. Torticollis or ray neck is a clinical condition in which head is bent to one side and chin points to the opposite side. So this occurs due to the spasm of the muscles, the major muscles of the neck, that is the sternocleidomastoid and trapezius, and these two muscles are supplied by the spinal accessory nerve. So spinal accessory nerve is the 11th cranial nerve. This supplies to these two muscles. So here this image is showing congenital torticollis. Here that contraction of sternocleidomastoid muscle may leads to head tilted towards that contraction of this muscle, and chin is pointed opposite to the contracted muscle. So this is about the ray neck. So next question, that is the about the musician nerve. So musician nerve is nothing but ulnar nerve. It also known as the nerve of the fine movements. So because it controls all fine movements of the fingers through its extensive motor distribution. So ulnar nerve is the mixed cranial nerve. So its motor distribution supplies to the all intrinsic muscles of the arm, hand region, and these intrinsic muscles of the hand involved in the fine intricate hand movements, and these are required by these musicians, so while playing the musical instruments, that's why ulnar nerve is called as musician nerve. So for the 2 mark question, so these points are enough to write that answer. Next question is about the basal ganglion. So the basal ganglion and nuclei are the subcortical and intracerebral masses of the gray matter. They forming important parts of the extrapyramidal system, and these are situated in the white core of the each cerebral hemisphere. So this includes number 1, it's a corpus striatum, and this corpus striatum is divided into caudate nucleus and lentiform nucleus, and these two nucleus are band separated by a band of white fibers. These are known as that projection fibers, that is the internal capsule. And this lentiform nucleus consists of the two parts. The lateral part is known as that putamen, and a medial part is known as the globus pallidus. So this is the total lentiform nucleus. So here, so this portion, that is the outer portion, this is the total known as the putamen, and these two are known as the globus pallidus. And next is that claustrum. Claustrum is nothing but a thin saucer shaped mass of the gray matter. It is located in the most lateral position. This is the claustrum. This portion is known as the claustrum. And the next is known as the amygdaloid body. So amygdaloid body is nothing but it is a almond shaped mass of the gray matter situated in this temporal lobe. So all three together known as the basal ganglion. So the number one is the corpus striatum, number two is the claustrum, number three is the amygdaloid body. So the functions of these basal ganglion are: the corpus striatum forms extrapyramidal system and it controls the muscle tone, posture and quality of the movements. And whereas amygdaloid body developmentally related to this basal nucleus, but functionally it is included with this limbic system. So the limbic system is mainly performs role in emotional and motivational. So next question, it is about the nucleus of the cerebellum. So cerebellum is also known as the little brain, and it is made with the outer thin layer of the gray matter known as the cerebellar cortex and center core of the white matter. So that within the center core of white matter, there are intracerebellar nuclei are present. These are also known as the central nuclei. This central nuclei is there are the masses of the gray matter, and on each side of the midline there are four number of nucleus are present. They are named from lateral to medial. That is the dentate nucleus. This is that red color one. Emboliform nucleus. So this is that yellow color emboliform nucleus, and fastigious nucleus. So this is that blue color one is that fastigial nucleus, and globose nucleus. So these are that four nucleus: dentate, emboliform nucleus, fastigious nucleus, globose. So this can be remembered by the mnemonic DEFG. So this like we can remember with the nucleus of the cerebellum. So next question is about the layers of the scalp. The scalp usually contains that 5 layers. So these 5 layers can be described with the mnemonic of this scalp, that is the S. S for the skin, C for the connective tissue, also known as the superficial fascia, A for this aponeurosis, and L for the loose areolar tissue, and that P for the pericranium. So SCALP, scalp itself is indicating the layers names. So these are the layers of the scalp. And the next question, subclavian artery branches. Subclavian artery is also called that artery of the upper limb, and it is because the name has given, it is located beneath the clavicle, and it is though two subclavian arteries, that is right and left subclavian arteries. Right subclavian arteries arising from the brachiocephalic trunk, and the left subclavian artery is arising from the arch of aorta. And this subclavian artery is divided into 3 parts by scalenus anterior. So this image you can see, this scalenus anterior muscle is dividing this artery into 3 parts, and that branches of this subclavian artery are 4 branches. Number 1 is the vertebral artery. So this is the straight one. This is straight one is known as this vertebral artery. Then thyrocervical trunk. This thyrocervical trunk is divided into this portion. So this is the thyrocervical trunk is divided into again 3 branches. Inferior thyroid artery. It is going to up inferior thyroid artery to supplies to the thyroid gland, and transverse cervical artery. So it located in the transversely, and suprascapular artery. So this is the suprascapular artery. So these are the three branches of thyrocervical trunk. And then third branch is known as the internal thoracic artery, which going down. And fourth branch is known as the costocervical trunk. So this is the costocervical trunk. So these are the subclavian artery branches. The next question is about the pharynx parts. So the pharynx is nothing but is a funnel shaped fibromuscular tube extending from the base of the skull to the esophagus. So the pharynx continues as esophagus, and it acts as a common channel for the both deglutition and air. It is divided into three parts. So nasopharynx, the pharynx which lies behind that nasal cavity is known as the nasopharynx. The part of the pharynx lies behind the oral cavity is known as the oropharynx. Part of the pharynx lies behind the larynx is known as laryngopharynx. So here in this image, we can see that this nasopharynx lies behind this nasal cavity, and this oropharynx and then laryngopharynx. The next question is about the larynx cartilages. So the larynx is known as the voice box. It is composed of the 9 cartilages. They are paired and unpaired. Then unpaired cartilages are the three. Those are the thyroid cartilage, cricoid cartilage, and epiglottis. Paired cartilages are arytenoid cartilage, corniculate cartilage, and cuneiform cartilage. So here in this image you can see this is the thyroid cartilage, and below that is the cricoid cartilage. The next question is about the refractive media of the eyeball. So refractive media of the eyeball include, number 1 is that cornea, number 2 is that aqueous humor, and then lens, then vitreous humor. So these are the parts of the refractive period, that is the cornea, then aqueous humor, then lens, then vitreous body. So these are the eyeball refractive media. Then next question is about golfer's elbow. So the golfer's elbow, also known as the medial epicondylitis. It is a clinical condition characterized by pain and tenderness over the medial epicondyle of the humerus. It occurs due to strain or tear of common flexor origin. There you can inflammation of the medial epicondyle. So for this repetitive use of these flexors of the forearm as during playing of the golf, so then there is an inflammation taking place that may leads to medial epicondylitis. So this is known as the golfer's elbow. So the golfer's elbow usually affect the medial epicondyle, whereas tennis people usually affect on the lateral epicondyle. So this is about the golfer's elbow. So thanks for listening.